Colposcopy is a procedure for clinical examination of the lower female genital tract, which includes vulva, vagina, and cervix. It is done using a magnifying device with light source called colposcope. Colposcopy is performed to examine inflammatory changes, injuries, cancer, or precancerous lesions in vulva, vagina, and cervix. Cells in our body are continuously undergoing changes because of the biochemical reactions, because of aging, and sometimes infection or trauma can occur. Trauma in the form of internal injuries can also occur, and in these three regions, that is vulva, vagina, and cervix, these can be picked up easily by the clinical examination and with the help of the colposcope, and we can come to know regarding certain diseases, especially the pre-malignant changes can be detected and biopsies, and hence the treatment becomes easy. So now coming to what are the indications for the colposcopy. When we do the screening test like when the pap smear, LBC or high-risk HPV DNA is positive, then we need to go for the colposcopy to confirm these tests. Beside this, unexplained pelvic pain, unexplained contact bleeding, and inflammation is also indication for the colposcopy. Coming to the pre-procedural instructions, one should inform the doctor regarding the menstrual status, pregnancy status, health problems like diabetes, autoimmune disorders, blood pressure, medications like oral contraceptives, or if you are taking over-the-counter medication, and any allergies. It is best done post-menstrually, that is when you are not bleeding actively, because whatever we want to see and whatever the colposcope can make us show is easily detected and biopsy. But in certain cases, even when the active bleeding, not menstrual bleeding, but bleeding due to other causes is present, it can be scheduled at any time of the menstrual phase except for the active menstrual bleeding. Instructions before colposcopy: do not participate in the sex and do not use any vaginal medication, douches, creams, tampons 2 days before the procedure. Your doctor might give you pain-relieving medication 30 minutes prior to the actual procedure so as to make you comfortable and relax. So what does the procedure entails? Normally, overall procedure takes 10 minutes only. One normally lies down on the back on a special chair with knees drawn up and legs spread apart. A device called speculum is inserted into your vagina or the lower part of the body to separate the wall and to visualize the cervix and vagina. Then the cervix is clean or vagina is clean because some discharge might be present or mucus might be present, which is clean with the saline. After that, certain chemicals which are really harmless like vinegar or Lugol's iodine are applied so as to delineate the normal or abnormal area. Colposcope is normally held around 20 to 25 cm away from your lower part of the body. If any abnormal area is found, biopsy is performed to send the tissue to be examined under different microscope by the pathologist. So what is the post-surgical care? Normally there is a vaginal bleeding which might persist for a day or two, or in case of some case where the biopsy is taken, it may persist for a week. There will be no restriction on your daily routine activity. Using douches, vaginal cream or participation in the sex is not recommended till all bleeding, pain, discharge subsides. You might also feel certain irritation or discharge for a day or two. In case you have got the fever, especially with the chills and rigors, heavy bleeding or pain in the lower abdominal area, you should contact your doctor immediately. What are the risks and the complications of colposcopy? Colposcopy is a safe clinical outdoor procedure. Major risks and complications include heavy bleeding, infection or pelvic pain or abdominal pain. In pregnant women, if colposcopy is done, it can lead to the early labor. And finally, sometimes your doctor might not be able to take the biopsy or might not be able to delineate the actual problematic area. So he or she might advise you some other test. So in nutshell, colposcopy is a safe, effective clinical procedure for examination of vulva, vagina and cervix.